Do you ever feel like there's a beast inside of you that just wants to get unleashed on somebody sometimes? Good. I'm glad it's not just me. Hey, I'm Dr. McCleary, licensed clinical psychologist and Navy veteran. And my channel is dedicated to educating veterans, service members, and their families about mental health. So if that's you, consider subscribing. In this video, I'm going to give you an analogy that I often use with veterans struggling with PTSD, and one that I actually wrote up and published in a military journal a few years ago. And that's the story of the werewolf. So most people are familiar with the fictional, I believe, story of the werewolf. But if you're not familiar, let me give you a brief synopsis. A wolf bites a human being, and then that human being turns into what we call a werewolf. Either they're turned into a real wolf, or they turn into some monster's version of a wolf. And often this is depicted in a very scary way, because it's something that is very scary, not just for the people that are chased down and potentially killed by the werewolf. It's also very scary for the person that got bit. The development of PTSD actually parallels the story of the werewolf very well. With PTSD, how it develops is someone experiences a trauma. Something happens. They get bit, if you will. And subsequently, their life is then changed. And for many people, similar to the werewolf, they have a hard time navigating this new way of life. Sure, a werewolf is scary for the people that are looking at the werewolf, but it's actually very scary for the werewolf themselves, because after a werewolf gets bit, after somebody experiences a trauma, oftentimes they end up lashing out. Oftentimes they might end up cursing somebody out, hurting somebody else. Okay. Well, the reason that that is scary is initially you may have no idea what's actually going on. You don't know what's happening. You just know that it's happening. It's depicted in the movies with werewolves a lot. Somebody gets bit and they don't know what's going on. They just kind of black out and end up in a pool of blood in the middle of the woods. They're like, what happened? This happens sometimes with people that experience trauma and have a lot of anger. Sometimes it's almost like they black out. And then whatever they did during that time, when they come back to being more stable, now they have to deal with the aftermath of what they did when they were out of control. This is a scary place to be, especially when you don't know when it's going to happen. So what does the werewolf do, and what commonly do people do that have experienced a trauma and have PTSD? What does somebody do that has hurt people that they didn't intend on hurting? Well, an easy one is you stay away from people. You remove yourself from anything that you think might can trigger you, will bring out the werewolf, if you will. And slowly yet surely, your world starts to get smaller and smaller. If you're getting value from this video, go ahead and smash that like button. Sometimes people will even avoid people that they really care about. And they're not doing it because they don't care about them. Actually, they're doing it because they do care about them. But when you don't know when you're going to potentially hurt somebody, it makes sense for somebody to avoid being around those people. Scary stuff. Someone who realizes they're a werewolf may chain themselves up because they may not know when something is going to happen. So, what does a werewolf do? You got bit. That happened. A trauma happened. That happened. What do we do with that? And a big part of recognizing that you're a werewolf, recognizing that you have PTSD, is knowing what's setting you off, knowing what your triggers are, knowing what your moon is, if you will. If you can start to recognize some of those things, well, you can do two things. You can either avoid those things, which I don't suggest, or you can work on those things, which I do suggest. So the question that a lot of people have is, well, I got bit. Will I always be a werewolf? Well, I had this trauma. Will I always have PTSD? Well, it depends on how you look at it. For somebody who has been bit by a werewolf, oftentimes they're a werewolf forever. So they have to learn how to manage being a werewolf. The path of working on your trauma and PTSD is actually very similar. The trauma happened. We can't change that. And you will always remember the trauma. And never will it be a happy story. That's not how it works. But can you learn to manage your symptoms? Can you learn to process the things that need to be processed to the point where you don't necessarily have the symptoms on a regular basis anymore? Yes, you can. Now, some people will argue, well, do you still have PTSD? Is it in remission? I'd say if you don't have symptoms, it's a good thing either way. The final thing I want to say about the werewolf is important because I think for a lot of people that struggle with trauma and PTSD, they look at it as if it's really a weakness. And I challenge that theory there. I challenge that mindset. Being a werewolf actually means that you're very powerful. Being a werewolf and having actually did things that you didn't actually want to do that may be out of character, okay. We all wish that those things never happened. But now you know what you're capable of. So there's actually a lot of humility in being a trauma survivor and being a werewolf, because you know what you're capable of. You know what you can actually get through. Well, that's something that a lot of people don't know. And there's strength in that. There's strength in being the werewolf. Because what? You know what? You know you can bite somebody's head off. You know it. There's some humility there. Because if you know what you're capable of, you can work on never getting to that place. Oftentimes I tell people, when you're overwhelmed, I don't really blame you for what you did, because you're overwhelmed. Did things out of character. What is more on you is letting yourself get there. Something to think about. If this video was helpful for you, and I hope that it was, please like it or consider subscribing to my channel if you want to learn more about mental health. But more important than that, if this video was helpful for you, well, that means it can probably be helpful for another veteran or another service member or another friend or family member of a service member. So I ask that you share it with them, because at the end of the day, that's really all this is about. One veteran trying to help another.